Welcome to American Dreams, Keys to Success, with your host, Alan Olson. He's a Bay Area native. He's a successful businessman, well-connected, and a friend to all. He's been published and quoted in various media outlets, and he's been honored for his philanthropic contributions.
Ain't that America, home of the free, yeah. Little pink houses for you.
Apple pie, baseball, and now here's All-American Alan Olson.
Welcome back. I have with me Kevin Thayer of Sigma Aldrich. Kevin, can you tell me a little bit about what your company does?
Sure, Alan. Thanks for having me on the show. My company, Sigma Aldrich, is responsible for supplying the drug discovery and research markets across the globe. I particularly focus in the Bay Area here, working with large pharma companies, universities, to help them develop or find that next lead or drug that needs to be discovered for to bring to market.
Wow. So the company's been around a while. I understand that you guys started with chemical warfare out of the 40s. Is that right?
In some ways. World War II brought a lot of demand in the market for different chemicals and different products. Our company started making a lot of money developing saccharin, which was needed to support World War II. And that's where we kind of got our start.
Wow! So it started with with taking people out. Now you're trying to save the people.
Exactly.
Pharmaceuticals
yes.
today.
We've shifted gears a little bit.
So what got you into this field here?
It interested me. I actually worked for a supply company previous to Sigma Aldrich that dealt more in a distribution fashion, and was always fascinated by the chemical side of the business. Working with customers to help develop medicines and different things like that. And I always took pride in the fact that we could develop or provide materials that assist with saving lives.
Wow. So what you see in the industry today, I guess you're primarily focused in Northern California, but any hot products and stuff that you guys are looking at distributing, and what's the growing area of the pharmaceutical market?
Well, there's always going to be a demand for pharmaceuticals. I mean, we've got an aging nation, people living a lot longer. Medicines are absolutely necessary to prolong lives and save lives. Some of the trends that I see are companies that are not only trying to discover new drugs. Everybody wants to find the cure to cancer or whatever it happens to be, but that's just not a reality right now. It's more improving the drugs that are out there today. When somebody considers taking a medication or a particular treatment, they have to outweigh, is the benefit greater than the risks or the side effects. So I see a lot of development in improving the existing drugs that have been around for 30, 40, 50 years.
It's interesting. A few years back, I had a chief scientist of a local Bay Area drug company come to me, and we started to work together, do some estate planning, income tax planning, looking at stock options and the works. And I asked the guy, I said, well, what do you do? And he says, I'm the chief scientist for this company. And he goes, and I started my career with working at cloning the sheep. And he was actually one of the guys on the project with this Molly the sheep. This is about 10, 12 years ago, and ended up showing that you could split some cells and through this genetic reengineering clone. And so he had been accomplished in this field, gained a reputation for himself, and then he went out and was going on the world circuit. He had went into developing a drug in the oncology. So it for taking a pill a day, it can actually control the growth of a single cancer cell, and it was really innovative. He had a degree out of Cambridge and Oxford simultaneously, and so as he was going on this world tour, he was down in Brazil, I don't know if it's Rio de Janeiro, one of the cities down there, and he decided to go out and run before his speech that day, and a bus hit him and killed him.
Wow.
Sad. I mean, it's really a travesty, but it kind of reminds us about our mortality here in Earth. But I'll have to say this: I think the longevity or the lifespan of what we're seeing because of the progress in drug research and medicine has been increasing. The number of years that we all have for our mortality here. When we're looking at the new markets and stuff that you're seeing, what's hot out there? What's developing?
I see a lot of smaller companies that are looking to find diseases that aren't necessarily life-threatening. For example, I'm working with a client right now that is looking for a improved medication for Crohn's disease. Now, it may not be a blockbuster drug or anything like that unless you have Crohn's disease. You're looking for something that isn't going to make you sick when you take it. So I see a lot of smaller companies, the 20 to 50 employee type biotech research companies, trying to take an idea and develop that into something that can be brought to market and ultimately approved by the FDA.
We're here today visiting with Kevin Thayer, Sigma Aldrich. We got to take a quick break. We'll be right back after these messages.
Protecting your family's health and welfare is a sacred trust. At Greenstein Rogoff Olson Company, we know that sound financial planning will protect them now and in the future. We're certified public accountants with tax services for the highly successful. For your business and your family, call GrowCo.
Greenstein Rogoff Olson Company will help you manage your financial affairs so you can focus on what's really important in life.
GrowCo, helping you along the way.
Ain't that America, home of the free, yeah. Little pink houses for you and me. Oh, baby, for you and me.
Apple pie, baseball, and now here's All-American Alan Olson.
Welcome back. We're here today visiting with Kevin Thayer of Sigma Aldrich. It's a pharmaceutical company located here in Northern California, and they serve the chemical and drug industry throughout the world. Kevin, as we were talking before the break, what do you see developing in the industry right now of drug and pharmaceuticals?
I see a lot of work in developing existing drugs. I see a lot of companies that are trying to improve what they have on the market today. I see a lot of different companies that are branching off, whether it be from a big pharma account, smaller spin-offs, or an individual researcher maybe having an idea that wasn't successful in their large company, so they'll go and actually try to run with that in their own company.
You know, it's interesting as we look at the drug market, and we mentioned that right now with this global economy, you're no longer limited to just selling within this country. It used to be the FDA would have to do approval for drugs, and it took quite a long process. And then all of a sudden, the rest of the world caught up and said, you know, we don't need all this process. We're just going to put the drug out there. And how has that affected competition today?
It's actually still very competitive because for every drug that actually is brought to market or produced that ends up on a shelf or in a pharmacy, there's probably 10 to 15 that fail. And it could be failed for whether it be regulatory from the FDA, whether it be another country having a problem with that drug, or it could just be that the science was bad, or you'd have to take a pill 25 times a day for it to be effective. So I see that more drugs are coming out. The process is being streamlined. It is a little bit more regulated, especially in this country. But from the time an idea that is actually developed in a lab to the time it's actually brought to market can range from anywhere from 7 to 10 years, which is still a long time, but it's actually a lot quicker than it used to be, with a lot tighter controls within different organizations and countries that did not want to have these drugs potentially hurt people.
Now, I once met a man who he raised monkeys, and these monkeys were used for drug testing. Does that still happen today?
It does. We actually don't dabble into that market. We're further upstream in the process where it's the molecular structure and the development of a drug. The clinical trials does still take place on some of the animals, but it's not something that my company gets into. It is an absolutely necessary process. You can't experiment on humans. So it's a necessary to try that, but it's very controlled, it's very humane, and it's something that very few companies actually do. So there's only a few people in the country that actually.
Well, I'll say that this guy lived in a state of fear. He didn't want anybody to know where he was living. His clinic was out in Florida, but he lived on the other side of the country in a very remote area with no address or anything. He just said that there's too many people and too much controversy out there for them to really know who he was and where he was living. So,
Oh, certainly. I mean, I have customers where the receiving process for these animals, if they are, is a complete enclosed underground structure, and they don't even let some of their own researchers know where the testing's taking place.
so let's go back to your career. So you're fairly young. What, 31 years old or
33.
33 years old? Yeah. How do you look at your job in terms of not just being a career, but being a business?
The unique thing about my current position with Sigma Aldrich is I'm a territory rep. I'm in the field. My company's headquartered in St. Louis, so there's not a lot of corporate demand. It's really my business to own. So the way that I would like to work with customers or different strategies that I may have are ideas that I come up with, whether it be networking with fellow people in the industry, or it be ideas that I come up with on my own, so I can really try to see what works and what doesn't. The way that helps me in my career is it is kind of an experiment to see if I can actually accomplish some goals, accomplish different ideas that I want to do with my business ideas in a environment where it's not financially going to hurt me or my family.
What's your greatest key to success?
I would say drive to make sure that every goal that I set, I accomplish. My father frequently tells me that I'm the only person he's ever met that can fall down in the mud and come out clean. And I attribute that to my drive and desire to make sure that I never fail.
My first boss, he used to say, those who fail to plan to fail.
Mm-hmm.
And so that's a catchy thing, reversing it back. But it's so true. If you don't have a direction where you're driving yourself and saying that this is what I would like to do to accomplish my goals, how do you ever make yourself accountable? So what do you see for the next 3 years or so out there? Is good market?
It's been a tough market for the last 5 years. I mean, our country's been in some challenging times, and that's impacted everywhere.
Hey, Kevin, we gotta take a break here, but
Sure.
but Kevin Thayer of Sigma Aldrich, we'll be right back after these messages.
You're listening to American Dreams with Alan Olson on AM 1220 KDOW.
Even in times of financial uncertainty, GROCO has been recognized as an expert in the tax field.
People come to us when they need help managing their affairs. They want solid financial advice while lowering their tax burden. For over 40 years, GROCO has been a trusted advisor to many of Silicon Valley's most successful entrepreneurs when dealing with the IRS and state tax authorities. We can provide a level of personal attention you won't find at national CPA firms.
For your time and for your wealth, call GROCO today.